Hello, I'm Dr. Frank Lombardozzi with Mill Chiropractic and Commonwealth Chiropractic and Massage Therapy. And we're going to be doing a few different types of stretches and exercises designed to help for the lower back. So this is for people that have lower back pain and also for people that have sciatica. And obviously sciatica is when someone has a problem with the lower back. It's putting pressure on the nerves that come out and go down into the legs, and people are experiencing pain or numbness or tingling go down into the leg. So the first stretch we're going to do, and we have Kels here, who's going to be helping us with the stretching. The first stretch we're going to do is one that helps to stretch the quadriceps, so that's the muscle that comes along the front of the part of the leg, comes up and actually attaches to the pelvis here too. So we're going to have Kels stand over here against this wall. We're going to be stretching your left leg. So always want to support yourself. And she's just bringing her leg up like this, and she's stretching out the front part of the quadricep there. And then if she wants, she can pull that up a little bit higher and bring the leg back just a little bit, and that's going to help to stretch out the quadricep. The second stretch we're going to do is a stretch for the hamstring, and we have Kels lying on her back because this is the safest way to stretch your hamstrings if you happen to have sciatica. So Kels, you're going to take that left leg and pull it up towards your chest there, and just hook your hands like that, perfect. And all we're going to do is she's going to use the quadricep, right, to actually extend the leg up. So go ahead and do a kick up, very good, and come down. So this is more of an active stretch to stretch out the hamstring, which is on the back part of the leg. When you look at the hamstring comes down and attaches into the pelvis too. So as we get the quadricep and the hamstring more flexible, it helps to loosen up the lower back area. Feel comfortable with that? Very good. Alrighty, so our next stretch is going to be called the cat-cow. And when we do the cat-cow, this is going to help to stretch out the mid-back as well as down into the lower back. So when we say cat-cow, first of all, like a cat, we're going to bring the back up. So go ahead and stretch upward. And as she's doing this, we're stretching all this part of the spine, all the muscles along the spine that come from the mid-back area down to the lower back. And now we're going to go down into the cow, which means it's just going to come, we're just going to let the whole thing sink. She's bringing her head up, that's perfect. So we're stretching once again. Come back up into the cat. Very good. And back down into the cow. Perfect. One more time. All the way up. Nice stretch. Bring your head down. Good. And come back. Perfect. Now from here, we're going to go into the transverse abdominal muscles. So we're going to have you stay there. This is going to be for the abdominal muscles. So the transverse abdominal muscles are the muscles that come across the abdominal area this way. As they come across, the muscles actually attach into some of the fascia or some of the muscles that come into the lower back. So this is a safe exercise to do if you happen to have sciatica or if you have severe lower back pain too. But as you strengthen the transverse abdominal muscles, it helps to support your lower back. So let's have you go ahead and get back into that same position there. On this one here, right, it's not going to be a cat-cow. All you're going to do is you're not going to see the spine move at all. The spine's going to stay flat. And what Kels is going to do is she's going to take the belly button and she's going to suck her belly button up against her spine. So suck the belly button all the way up. Good. Hold it there for about 5 seconds and then let it relax down. Don't move your spine. Go ahead and just suck your stomach up. Like you're bringing your belly button up to your spine. What she's doing is the transverse abdominal muscles are helping to pull all the organs up kind of thing. So it helps to strengthen, once again, the muscles that come across this way. Go ahead and suck it right all the way up. There we go. And then let it come on down. All right, so this next stretch we're going to be doing is a stretch for the lower back. It's a rotational stretch. So what Kels is going to do is you're going to bring your knee up towards your chest kind of thing. And now you're going to let that leg fall right over. Very good. Bring that right arm out. Good. What we're doing is we're actually stretching the lower back muscles. And then we're going to come over. We're going to do the same thing with the other side. So bring that one down. Left one comes up. There we go. And perfect. Yeah, let's do it one more the other way. Very nice. Mm-hmm. All right, the next exercise we're going to do is what's called Mackenzie extension exercises. This is a great exercise for people that have sciatica, because when you have sciatica, a lot of times you have a disc protrusion where the disc is actually coming backward and it's hitting up against the nerve. So as we do this exercise, it helps to pull some of that disc material away from the nerves and decrease the pain that radiates down into the leg. So all Kels is going to do is you're going to push yourself up, and you can keep your pelvis on the floor. So the pelvis is staying on the floor, and she's just coming up like this. Now when you do this, the goal is to get to about a minute, and then lay back down and just kind of like move your pelvis around a little bit. But yeah, so make believe that she's been there for a minute, And if you can't do a minute, obviously start with 15 seconds and work your way up. Then you're just gonna come down and just kind of shift your pelvis around a little bit. Good. Now come back up. We're just coming up into extension again. Once again, you're holding it there for whatever you feel comfortable. Sometimes you might start with 15 seconds, then you slowly work your way up to about a minute or so. Very good. All right, from here we're going to go into lower back extension exercises. So this is going to be a strengthening exercise where she's strengthening the lumbar muscles down here, the lumbar erector spinae muscles. So we can start by just putting your hands down by your side, and you can bring yourself down a little bit. Now all you're going to do is just lift your body up about 1 inch. So you're using these muscles along the lower back to go ahead and lift your upper body up. Very good, that's all. And come on down. Now if this is too easy, you can take your hands and put them under your forehead. So now we're shifting your arms up, so we're increasing upper body weight, and now you're gonna lift your whole body up again. Perfect, and come on down. Come back up. Once again, we're using these muscles in the lower back, and come on down. And one more time. Perfect, very good. And the last exercise we're going to do are going to be some lower back bridges. So this is nothing more where she has her feet planted on the floor, and she's going to be actually lifting up her whole pelvis towards the ceiling. So go ahead and lift your pelvis up, hold it there for a couple seconds, and come down. And then we're going to come up again, and then come down. Now as we're doing this motion, it's just helping to increase the flexibility of the joints in the lower back and helps to keep fluid moving in and out of the discs. Also, when you're doing this exercise, you'll feel it in the lower part of the abdominal muscles too. It helps to strengthen the abdominal muscles. Perfect, Kels. Very good. Alrighty, so those are the stretches and the exercises we're going to go over today. Once again, these are great exercises for people that have lower back pain as well as for people that have sciatica. Now, if you're doing these exercises and the lower back pain or the leg pain continues, then obviously you want to see a chiropractor where you're having a full consultation, examination, any necessary x-rays to figure out exactly what's the underlying cause of the problem and what's the best way to correct it. Thank you.